Whenever we go through school, we really don't know who, if you're a patient, who is treating you unless you look at their credentials. Whether they're board certified, for example, what area they may be, if they're a specialist, if they're a general dentist, what type of education they've had. And certainly, the education varies from person to person. But there are many people, most people in the AO, they wouldn't be in the AO if they didn't appreciate the science and the technology and advancing that for the ultimate care of their and benefit of their patients. What we want to do is recognize that. And so we're recognizing that through a certificate program. And at this point, we have the master's and the diplomate level. Each level is a little bit different in regards to the obligations. The master's, for example, you have to demonstrate that you've completed 150 hours of CE credit, whereas the diplomate, 300 hours. So this is substantial, but it demonstrates your commitment to implant dentistry. We also have an exam for a master's. It's a 1-hour person-to-person exam. And for the diplomate, it's a 2-hour clinical exam. Then you have to demonstrate cases and bring certain cases that you've done, and there's certain categories. For a master's, it is 3 cases, and for the diplomate, it's 5 cases. And all of this, again, sets a baseline to demonstrate your commitment to implant dentistry and to offering the best that you can.
By launching this AO Credential, AO Master, and AO Diplomate credential programs, we actually serve our members' needs and also raise the standard among our peers to maintain a higher standard of educational, to train the individual who are qualified, has expertise, knowledge, and skill to provide the service our patient wants.
I think credentialing is important because it shows a level of achievement. And if you can fulfill those requirements, that means you have really challenged yourself. You have completed the education required, and you have also completed the cases that are required as well. And I think it gives you an opportunity to really showcase your work and your accomplishments. And also, if you're in private practice, it's such a prestigious award to have and to tell your patients and your community about. So I think in all respects, it's wonderful professionally, it's wonderful for your community, and it's something you could be very proud of.
The credentialing board for the Academy of Osseointegration are people selected to create a dynamic of requirements for credentialing for the masters, the AO masters, and the AO diplomate. As you already know, the Academy is made up of specialists, perio, oral surgery, prosthodontists, and general dentists. And these people, by the way, are not just any specialist or any GP. They are at the highest level. So when we're looking at doing the credentialing, these people will be held to a high level and a high standard. And to get that documentation, it's not just something you give, it's something you earn.
So we have approved the AO Training Center, and eventually that training center will be globally positioned. That's including the US, North America, and all over the globally.
Our program is open to all specialists and all general dentists and anyone that would like to apply. I think it's a reasonable and attainable certificate as well. And I think that the requirements of the case presentations are something that you would do every day. So it wouldn't be that difficult to put that together. And it would challenge you to photography and also to document your cases really nicely.
What sets the AO certificate aside and different and unique from other certificates is that we're very much based in science and the technology and the education. It's not just, let me show you and demonstrate a handful of cases and moving on. We want a very stringent policy that will demonstrate your commitment, not only to implant dentistry, but to the welfare of your patients.